Concerns around the impact of external influences on children and their overall mental and physical health seem to be rising amid more research pointing to the connection between them. A recent study funded by the Heart and Stroke Foundation finds that children are being bombarded with messages in grocery stores and restaurants that make junk food look more appealing. Meanwhile, a Vancouver woman has filed paperwork in BC Supreme Court against video game maker Epic Games. Now, she alleges it designed its popular game Fortnite to be as addictive as possible for children. Some argue that children and youth are especially vulnerable to such influences because they may not have the cognitive maturity to differentiate between marketing and entertainment. But in a more digitally connected world, how can parents protect their children from the potential harms of marketing tactics? Well, joining us now to help us with this is Dr. Leia Minaker, a public health expert and associate professor for the School of Planning at the University of Waterloo. Dr. Minaker, welcome to Forum Daily.
Thanks for having me.
So, marketing can be seen nearly everywhere we look, but how does the marketing on children differ in terms of its overall impact on mental and physical health?
That's a great question. I think it's one really important to consider, especially when we think about our role as parents, as educators, as anyone in society when we think about protecting kids. So, the biggest difference when we think about marketing to kids versus marketing to adults is that kids under 5 typically cannot tell you the difference between when they're watching a commercial and when they're watching a program. They don't understand what is happening in terms of someone trying to sell them something. Kids about 8 and under can sometimes tell the difference, but they still don't understand the intent behind the marketing and they tend to just believe whatever they're told. And by around 10 to 12, kids usually start to understand the difference between, for example, marketing and someone telling them the truth about everything, but they're not always able to be critical about the methods or what the actual intention is.
Very interesting information there. Now, in terms of this recent study funded by the Heart and Stroke Foundation, what do we know so far about the marketing of junk food in particular and how it could entice children and ultimately lead to sales?
What we did in our study is we looked at over 2,000 restaurants, about 800 stores, and we took about almost 7,000 photos from all of those stores and restaurants across 11 regions in Canada, including Canada's north and urban and rural areas. And what we found was that there was a high level of marketing of unhealthy foods and beverages to kids. And so what we did, for example, we looked in stores at the number of island displays that might have, cartoon characters on them or child themes, which we consider to be like magic or zoo animals or rainbow colors, bright colors. We looked at checkout aisles and that looked at the kind of variety of different kinds of sugary or salty snacks available there. We also looked at interior and exterior marketing, for example, in restaurants, at kids' meals. So, for example, how many, restaurants give kids meal or toys or other child-oriented giveaways just for purchasing a meal. So we did a sort of a large study, the largest of its kind in Canada, to do a baseline assessment of what's happening in terms of marketing at the point of sale to children. And we found that there was a very high prevalence of marketing to kids.
And how do you see the marketing of junk food and other products impacting a child's potential dependency on unhealthy foods into adulthood? I'm talking about maybe sugar addiction, setting up unhealthy habits, or maybe even obesity in the near future.
Yeah, we know that marketing to kids is bad for their health in terms of increased consumption of those types of foods that are being marketed. And in our study and lots of other research that's been done in different types of settings shows that, that predominantly, like the vast majority of ads are for unhealthy foods, not for healthy foods, which is not really surprising. That said, those are the kinds of foods that kids are going to be consuming more of as a result of the marketing, which does have long-term implications for their health. And dietary risks is one of the three biggest determinants of death and disease in Canada. It's one of the leading causes of global morbidity and mortality. And so I think anything we can do to try to improve Canadians' diets and especially kids' diets, the better for long-term health. In terms of addictions, there's, I think, some debate around that still in terms of whether or not marketing leads to, addictive like eating. But I think that in general, it's important for all of us to be eating as healthy as we can and not to have multi-million or multi-billion dollar businesses undermining our efforts to eat healthy.
All right, Dr. Minaker, a quick 30 seconds left here, but if you could leave us with one piece of advice, especially parents in terms of protecting their kids from such marketing harms, what would it be?
I mean, of course, it's parents' jobs to say no when their kids pester them for something at the grocery store or restaurants. That said, it would be great to have some regulations in place that would help parents do the job of keeping their kids healthy by making it easier for them to say yes to healthy foods to their kids.